Today more than ever, efficiency plays a role in the success of a medical practice. A well-trained, knowledgeable staff can improve the patient experience and the bottom line. Now, Remedy Healthcare has developed e-learning, role-specific training that focuses on the knowledge that specific jobs require. Each curriculum includes courses or modules suitable for its role. But medical practices also can customize their curriculums by choosing different modules. Let's see how the system works. Each module has a pretest, course content, and evaluation. The purpose of the pretest is to see generally how much the user knows, as well as how much they think they know. So the first question asks the user to estimate their knowledge level. Then they answer a few general questions about the content. When they're done, they submit the assignment. Throughout the curriculum, they'll always be asked a second time if they want to submit an assignment to make sure they didn't hit the wrong button. The course content is presented like an open book test. For example, the hypertension module includes sections related to definitions, risk factors, normal functioning, causes, and treatment. Questions appear immediately after each section. This key learning technique has been proven by Lumen Touch to improve retention of new information. The number of questions varies from 8 to 20 per module. A second key feature in the content section is that the user can check their answers to the questions. If they're wrong, they can go back and review the content and try again. They can do that as many times as they like, because we want them to learn the answers. Another proven learning strategy is that the more interactive an activity is, the more a user enjoys it, and the more they learn. So you'll see some fun presentations in our content, different colors, movable pieces, multiple choice, and so on. And as you'll see, the content in this curriculum is basic but thorough. Now we've come to the Remedy feature that you won't find anywhere else. Throughout the content and evaluation section, the staff member will be evaluated on the content they need to know based on their role in their medical practice. For example, unlicensed clinical staff would be doing medication review, so we'd want them to be able to recognize the hypertensive medications. So we have a question about that. For nursing staff, we'd want them to know a little bit more. So you may see the same content in the nursing staff or licensed clinical staff module, but maybe we're asking more questions about the functionality of the medicines, and so forth. Once the user is finished and feels good about their answers to the questions, they submit the assignment and go to the evaluation. This is where they are asked to apply the concepts they learned in a case scenario. For example, the first thing a medical assistant would do when they see this patient in their exam room is note the blood pressure. They'd want to notify the physician immediately because the blood pressure is so high. But for a nurse, you would want them to assess what medications have been taken today, other symptoms, maybe a brief history, and so on. The content is based on the role. The last thing we do is ask users if they think that their knowledge is a little higher than it was before, and if the content was easy to understand. They can also make comments about the content. Then they can submit the assignment if they're ready. Once it's submitted, users can pull up their results immediately and look to see what is correct and what is incorrect. They can choose to redo the evaluation page right away or go back to course content, retake the modules, and relearn the content. They can go through the modules and relearn the content as often as they like, but they can only take the course evaluation twice. After the user is finished with their assigned module, a supervisor will receive a report. It starts with the pre-exam and gives a snapshot of what their knowledge level was before going through the modules. The evaluation shows us what they gained from going through the course. If the score is low, we can see how they did in the course content. And depending on how the two scores compare, you may want to have the user take the course again. You'll also be able to see how long they spent on the course. Each participant gets a certificate showing the modules that they completed, and nurses will receive a certificate that they can use to receive credit for continuing education. The beauty of this system is that it provides curriculums for different staff roles in medical practices that can be customized based on a practice's needs, and it measures the knowledge competency of the staff. To discuss how eSolutions can help your practice team members, contact us at Remedy. Now is the time to improve your team's knowledge competency.